Good evening, everyone. My name is Masato Otaka. I'm the press secretary of the Foreign Affairs, and we would like to hold our periodic press conference on the COVID-19. Today we have speakers from relevant ministries and relevant bodies, as well as experts on this matter as well. I would like to introduce Mr. Tomochika Uyama, who's the Director General at the Office for Coronavirus Disease 2019 Preparedness and Response at the Cabinet Secretariat Office. To his right, we also have Mr. Professor Hitoshi Oshitani, Professor Hitoshi Oshitani from the Tohoku University Graduate School of Medicine. Further to his right, we also have Mr. Yo Osumi, the Deputy Director General of the Consular Affairs at the Foreign Ministry. Furthest to the right, we have Mr. Seiji Matano, who is an attorney from the Immigration Services Agency as well. In the back seat, we also have two gentlemen from the Ministry of Health, Labor, and Welfare. We have Mr. UMEDA Hiroshi and Mr. Kazuho Taguchi, who will be stepping in matters that are relevant to them as well. So without further ado, I would like to begin by giving the floor to two gentlemen who will be making their opening statements for this conference. First, Mr. Uyama, please.
Good evening, ladies and gentlemen. I'm Tomochika Uyama from the Office of COVID-19 Response, the Cabinet Secretariat. Thank you for coming today. Since the beginning of the pandemic, the number of deaths has been less than 1,000 in Japan, which is significantly lower than most other developed nations. The state of emergency was lifted on May 25th, and we are in the process of reopening our social and economic activities step by step. As we have explained, Japan has been taking a science-based approach, encouraging the public to avoid the situations to create clusters, namely the three C's: closed spaces, crowded places, and close contact setting. We also continue to encourage the general public to do such actions as thorough hand washing, wearing masks, using disinfectant to clean surfaces, and ensure proper ventilation when indoors. Recognizing the nature of the virus, which spreads mainly through clusters, we have utilized the method of retrospective contact tracing when the infectious case is identified. In the standard method, contact tracing is done to determine who a person has been in contact with after being infected. But in the case of COVID-19, however, only about 1 person in 5 is contagious. So it makes more sense to track who they have been in contact with prior to being infected. This has enabled us to identify infection clusters, which has been extremely valuable in limiting the spread of the disease. While it is necessary to maintain strict measures to control the spread of the virus, it is also important to allow social and economic activity to resume. According to the plan from June 10th, it is now allowed to have the stadium events with necessary prevention measures for up to 5,000 spectators, or the half of the capacity of the stadium, whichever number is smaller. As you are aware, we are witnessing a new situation where the number of infections has been increasing over the past week. Having more than 200 confirmed cases for a number of days in Tokyo is cause for close attention. However, the situation is quite different from the one in April, as we currently have a much smaller number of patients experiencing severe illness than in April. At the disease peak, there were 105 severely ill patients in Tokyo, and now, as of yesterday, there are only 5. I'd like to point out some important points concerning the current situation, especially since the lifting of the state of emergency from the date being gathered. First, since the beginning of June, after the state of emergency was lifted, people in their 20s and 30s have made up 70% of all new cases. Second, it has come out that a significant number of new infections have been traced back to nightlife entertainment businesses, including bars, host and hostess clubs, and other similar establishments where people are in close contact with each other. Third, on a positive note, while PCR testing capacity in Tokyo has increased, the rate of positive tests has fallen dramatically. In April, it reached a high of 32%, but since then it has fallen to around 5 or 6% now. There are, however, 3 causes for concern. First, as I mentioned, a large portion of new infections were among people visiting nighttime entertainment spots. One danger this presents is the possibility that people who go to these businesses in different neighborhoods could possibly be transmitting COVID-19 in other places. Second, another source of new infections has been young people gathering at parties or for drinking and eating together. These are opportunities for the disease to spread, and one of the reasons why people in their 20s and 30s make up such a large percentage of new cases. Third, and related to the second point, is that young people who become infected with COVID-19 at social events could then spread the disease at home to their older family members who may be much more vulnerable from previous experience. Before ending my remarks, I'd like to talk about our new approach and countermeasures. First, expanded testing capabilities. In addition to the expansion of PCR tests, antigen tests are available. They now have the same approximate accuracy as PCR tests. The results are available after a short time, and the tests are covered by health insurance. Good news is that it is possible to perform antigen tests via saliva samples, as with PCR tests, making the test much easier and less risky for both patients and health professionals. Second is the targeted countermeasures focusing on nightlife entertainment businesses. We are requesting them to honor the guidelines to prevent infection. We also encourage a wide-scale proactive PCR testing for employees, even if they don't have any symptoms. Third, we will be strengthening the capabilities of local hokenjo or public health centers. Providing these facilities with additional public health nurses to perform appropriate activities will be an important step. In addition, AI simulations are proving to be very helpful, providing us with valuable information about how the virus can spread, as well as just how effective the countermeasures, such as masks, are in reducing the risk of infection. We are expecting more to come. Today, we have Dr. OSHITANI, who is continuously advising the government. He will now present for you our strategy from an expert perspective. Thank you very much for your attention.
Okay, thank you, Mr. Uyama.
上山審議官、どうもありがとうございます。お知らせないんですけれども、押谷先生はこの資料を配布してあるんですけれども、ベースに行って。
Now I would like to invite Professor Oshitani, please.
Thank you. Good evening. I'm going to use this handout, and can you open the page 3. These are our strategy up to now, and I think I explained this strategy in a previous the press conference. But our strategy, they include the retrospective contact tracing. In many other countries, the prospective contact tracing, there are many done. But in addition to the prospective contact tracing, that we are doing the retrospective contact tracing to identify the common source of infection, which is likely to be the cluster. As Mr. Uyama mentioned, without forming a cluster, this virus cannot be sustained because many people do not infect others. And also, by analyzing many clusters, we found the common characteristics of the clusters, which is now called as the 3 Cs, the crowded spaces, crowded places, and the close contact settings. And in order to prevent a new cluster from the emerging. And by identifying these 3 Cs, environment as a risky environment, we managed to send more effective the messages to the public to avoid such setting. And of course, we are also promoting personal hygiene, like hand washing, the use of mask. As you probably know, the majority of the people are now wearing a mask in Japan. And also the proper ventilation. Ventilation is quite important to prevent the spread of this virus. And then next slide shows the so-called epidemic curve, the daily number of the cases by date of onset. Actually, this is a date of confirmation, sorry. With the increasing number of cases from end of March, the Japan declared a state of emergency on 7th of April. And but number of cases decreased since early April. And state of emergency was lifted on 25th of May. But recently, the number of cases is increasing, especially in Tokyo, and which need to be closely monitored. But the situation is quite different. Actually, the number of daily cases are similar to those in the early April, especially in Tokyo. But the situation, even in Tokyo, situation is quite different. And in the next slide shows the daily number of critically ill patients who require the respirator, the support, or in Tokyo. And so the number reached nearly 100 at the peak, but now only 5 in Tokyo who require the mechanical ventilation or the critical support. And so the situation is quite different. And the next slide shows the summary of the current situation. So many new cases are actually coming from the nightlife setting, especially in Tokyo. And also, we are doing more proactive testing. When we found the clusters in such setting, even asymptomatic cases, asymptomatic people are being tested. That's why the number of cases is increasing. That's one of the reasons why the number of cases is increasing. But 70% of cases are in their 20s or 30s. Most of them are young people. And as you know, the most severe cases are occurring in elderly people, not only in Japan, but also in most of places. And but the issue is the difficulties in contact tracing, especially in the nightlife settings. Since many of them are young, they do not develop severe symptoms. Most of them do not. Some young people, of course, develop the severe symptoms, but most of them do not develop severe symptoms. And or even asymptomatic, meaning they do not develop any symptoms. And also, in this kind of setting, the contact tracing is also difficult due to the social reason. Some of them do not want to tell if they went such the entertainment places. And that's the difficulties we are facing to now. And the next slide shows the age distribution of cases between the early the first phase of outbreak and the current phase of outbreak. And as shown in this figure, the age distribution is quite different. From the end of March to early April, we had many cases in elderly. We had the outbreaks in the nursing home or the hospital where the many the elderly people are hospitalized. But now the majority of the infections are occurring in young people in their 20s or 30s. And that's why we don't see the many severe cases. And some of or many of these the cases at the nightlife settings that are detected by more proactive testing. And the next slide summarize our new strategies. Since the beginning, the objective of the approach for COVID-19 is to minimize social and economic impact while minimizing the spread of the virus. And so we are now trying to implement new strategies to better prevent the spread of the disease, including AI simulation model, and new technologies for the contact tracing, including the mobile app. And also, we have been developing a lot of guidelines for the different settings, restaurants, bars, the sports gym, and so on. And we are still we still have the room for improvement. These guidelines are not strictly implemented in some setting. That's why we are still seeing the clusters in the different settings. So the implementation of these guidelines is still challenging, but we are trying to find a better solution to minimize the forming of a cluster. And now the testing capacity is increasing, and we are planning to do more proactive testing. And the next slide shows an example of simulation of the spread of the COVID-19. And in past few days, a lot of discussions about the aerosol transmission. But since the beginning, we considered the small particle, the transmission. And that's why we proposed the 3 Cs. To avoid the 3 Cs, is a key to prevent the spread of the COVID-19. And so the pictures illustrate the importance of the wearing masks to prevent the transmission through the small particles. And the next slide also illustrate how the virus can spread through the droplet. Droplet is a larger particle, and also the smaller particles. And so the result by using the supercomputer Fugaku are being done, and they are also simulating the spread in the different settings, including concert hall and some other settings, which we believe that they are very crucial to improve our guidelines in different settings. And from the next slide, I'm going to explain briefly about the testing strategies. As you probably know, in early days, the PCR testing capacities were limited in Japan, and also number of the available hospital beds were insufficient. But the quality of test need to be ensured, and we also we were trying not to create the panic type of the situation in a testing center or the hospital or clinics. And if the people rush to the clinics or the testing center for the just testing, just because they are worried, it may create a 3Cs environment. We were trying to avoid such the environment to be created. And the next slide, they explain the summary of the basic vision and the strategy in the next the phase of outbreak. And now state of emergency has been lifted, and there is a need to consider the infection countermeasure together with the social and economic activities. And so the testing should be done in the strategic and the more proactive manners. And so we are considering the 3 different categories of the people to be tested. And next slide shows these 3 categories. People with the symptoms, especially the people, when the physician, they think that the testing is necessary. In this setting, always the testing should be done. And that's why we are expanding the testing capacity, including a new type of test like antigen detection test. And the second category is people without symptoms who have been assessed with a high pre-test risk of infection. For example, if we identify some clusters in the nightlife settings, we may need to test more people at that setting. And that's what we are doing in some places in Tokyo and some other places. And the more proactive testings are being done. And the third category is people without symptoms, who have been assessed with a low pre-test risk of infection. So actually, in this category, we are still discussing what we should do in this category. And the next slide, the people with symptoms, as I said, when the physician consider the testing is necessary, these people, the patient, should be tested. And this is our first priority of the people who should be tested. And some other testing method like the antigen, the detection kits are now available in Japan, and some other testing methods are also available. And the next one is the people without symptoms. And as I mentioned, we are conducting the more proactive testing for the people who are at the higher risk of pre-test risk of infection. And we are also considering to test the people working in hospital or nursing homes, or some hospitalized the patient in the hospital. And we are still discussing how best the testing capacity can be used to prevent the outbreaks in the nursing home and hospitals. And the next slide explain the third category. As I mentioned, we are still discussing what to do with this category. And actually, now in another place, some experts are discussing how best we can test the people in this category. And the last slide, they illustrate the issue with the PCR testing. Many people believe that the PCR testing is quite sensitive and specific, but actually the PCR testing has some limitations and some critical limitations. Especially the sensitivity is not that high. The real-time PCR, the so-called real-time PCR, is being used in many different places, including Japan. Real-time PCR is testing itself is very, very sensitive. But for this virus, the PCR, real-time PCR, is not that sensitive because some people do not shed the virus in upper respiratory tract. If you test the sample from upper respiratory tract, like a throat swab or nasal swab, you may have the false negative result. Meaning your testing result can be negative, even if you are actually infected. And also, no test can be perfect, and there's actually virtually no test for anything with 100% specific. So if the specificity is the 99%, if you test 100 people, then you will have the one false positive. Even if it's a 99.9% the sensitivity, if you test 1,000 people, you will get one false positive. That means your test is positive, even if you are not infected. So for example, if we consider the situation with a total of the 10,000 people, the 100 people are infected. Then if we use the test with 70% sensitivity and the 99% specificity, among 100 positive the people, only 70 can be detected. And but the 169 people that can be tested positive. That means the more false positive, the 99 people are tested positive, even they are not infected. So this false positive may result in the people taking unnecessary measures, such as self-quarantine or hospitalization. And also, the false negative result may result in the people unwittingly spreading the disease. Because if you get the false negative the result, you may have a false sense of security. Even if you tested negative, it doesn't guarantee that you are not infected. And for example, if you are the day 2 or day 3 after the infection, and your testing result may be negative, and but on day 4 you may become infectious, and after the testing negative, you may spread the virus. So the PCR testing has these limitations, and we need to explain these limitations to the general public, and also the healthcare workers still do not know the limitations of the testing. So we need to explain these. And in conclusion, now the number of cases is increasing, and we need to monitor the situation closely. But in Tokyo, they are doing more the proactive measures, including the proactive testing. And I hope that the measure can be effective in reducing the spread of the virus. Thank you very much.
Thank you, Professor Oshitani. Now we would like to open the floor to questions, starting with the participants in the room. If you have questions, please step up to the microphones in front of you, and do state your name and affiliation before asking your question. So anybody? I saw him first. Yes.
Good afternoon. Rocky Swift with Reuters. I was hoping to get an update on the contact tracing app, COCO. I believe last Friday there was a notice that there was a kind of error with the app. So firstly, can you give an update on when the app will be fixed or updated? Second, do you have figures on the total number of downloads? And third, has it been successful so far in tracing or finding any infections? Thank you.
Okay, thank you, Mr. Swift. Perhaps this question should be addressed by Ministry of Health, Welfare and Labor. Mr. Umeda?
失礼しました。厚生労働省健
Hello, I am UMEDA from the Infectious Disease Information Surveillance Office. You asked me a question about COCO. Thank you. As you had rightly pointed out, as of last Friday, 1700, 6.6 million downloads have been made. But a little bit, the contact notice, those found positive have to make an entry. But in making the entry, there are some cases where it didn't work. So right now, there is a processing number which are assigned, and you need to enter that number, but it didn't work. So that the processing number issuance is being suspended as of now, and how it would recover is something that we are working on. So we are dealing with it as soon as it becomes possible to repair it. But we cannot specify the exact timing by which this will be repaired. But we are working on it very quickly, as soon as possible. So within this week, I don't know, the part of this week, we hope that it can recover and be repaired. Thank you.
For Mr. Swift?
Just the third part, has it been successful yet in finding or tracing any infections so far? Do you have any figures on that?
Sorry, I missed your question. So with regard to your question, so I said that there are cases where entries could not be made, but 3 people had made a correct entry. That is as far as we got in terms of data. But with regard to these apps, who they are actually, or when the contact was made and such, we only know the number, not the specifics. So we don't have much more information more than the exact number. So people who made an entry would make a notice to the people who had come into contact with that infected person. That is how it works. But we have the situation is such that we cannot follow exactly what is happening. But the notice have been made by the 3 people in terms of the infection. That is as far as I know.
I saw this gentleman right here.
Thank you. My name is Ivan Zakharchenko. I'm from the Russian news agency in Tokyo. I have three little questions. First, you said that in Tokyo, the tests are more intensive. Could it be the reason why you have more cases here in Tokyo than in other areas? I've heard that one person said that this is not the pandemic of the virus, it's pandemic of tests. Secondly, can you name mistakes which were made since the beginning dealing with the virus, just to prevent it in the future? Not only with this virus, maybe the next virus. Can you name some mistakes, if they were? And another one, sorry. Yeah, you mentioned that the group of persons you are going to test, the second group is those who are without symptoms. But how many times do you need to to test them? Because okay, today you tested the person, he has no symptoms, he has no infection. But tomorrow, the day after tomorrow, so how often would you make these tests for the people and the risk group in the facilities like nightclubs and so on? Thank you very much.
Okay, thank you so much. I hope we understand your questions correctly. I think the first one was about the increase in the number of tests in Tokyo, and why is that? Is that the question, or?
The question is, you mentioned that you make more intensive tests in Tokyo. Could it be the reason why you have so many cases?
Okay.
So the more tests, the more results. Is it so? Thank you.
And the second question was a mistake with regard to
Yeah,
perhaps maybe we could
any mistakes
focus
dealing
on
with the
corona.
virus? Were there any mistakes? If they were, could you mention it to avoid it in the future?
On this COVID-19.
Yes, but there can be other viruses, and just to prevent any mistakes, can you name the mistakes which could be made dealing with this virus?
Perhaps Professor Oshitani can highlight some of the things that he feels that he needs to mention. But anyway, these three questions, Oshitani-san?
Okay, I'll try. And for the first question, it is true that we are doing more proactive testing, but at the middle of May, it was relatively quiet in terms of the spread of the virus. We did not see many new cases. From the end of May, the number has been increasing in Tokyo and some other places. And we believe that it's mainly because of the virus spread in the nightlife settings, as I mentioned. And so actually the virus activity was increased since the end of May. But we are trying to suppress the spread of the virus, and one of the strategy is the more proactive testing, and that's why we are seeing the many cases with very mild symptom or even without symptoms, because we are testing even the people without symptoms. If they are at the venue where some transmission occurred, we are testing these people even if they don't have any symptoms. And so the increasing number of cases, partly because of the proactive testing, but that does not explain all of increasing in number. And we do have some increasing activities, but since we are doing, or especially the people in Shinjuku and other places implementing more aggressive measures, that we hope that the virus spread can be reduced in these settings. And also, in terms of mistakes or the weakness of the Japanese response, Actually, the Japan was not well prepared for this kind of outbreak. We did not experience any the major outbreaks of emerging diseases in past 20 or so years. In other Asian countries, they had the SARS in 2003, and also the MERS, Middle East Respiratory Syndrome outbreak in the Korea, and so that's why the Japan was not well prepared, and that's why the PCR capacity was limited initially. But with no country, they could be perfect to be prepared for this kind of unexpected outbreak. And we've been trying our best to minimize the impact. And so far, we've been relatively successful in reducing the impact of this the virus. And so the second category of the people to be tested, especially asymptomatic people, we are still discussing how best the testing can be done for this category. And it's not easy, and we cannot test every day. And even in a hospital or nursing home setting, we cannot test the stuff every day. So we are trying the best strategy to detect the early sign of outbreak in these settings. So the discussion is still going on, and we have not decided what strategy that we are going to use for the category of people.
Thank you, Professor OSHITANI. Okay, then please.
ラジオフランスのラジオ
I am from Radio France, correspondent Nishimura. I have 3 questions. First of all, at the end of March and the early April, compared with that timing, you said that current situation is different. But as for the ventilators, people who need them, and also there's a time lag between the people who have been infected and who will be in need of the ventilators. So over time, there are cases where people get more severely ill. Of course, if you look at the age group, as far as the newly infected people, most of them are young people. But within young people as well, in overseas, it was observed that some young people will develop a severe symptom as well. So what is the situation likely in Japan? That's my first question. And the second has to do with tests. So restaurants and bars, mainly in Shinjuku and Ikebukuro, proactive tests are being done. But within Tokyo, what about other places? So if a proactive tests are done elsewhere, then would you say that there are likelihood that people who will be detected without having a symptom? So what would you say these kind of situations develop? My next question is, if you look at the foreign residents in Japan, if they go out of the country, then they cannot return to Japan. That situation continues to this day. Do you have anything to say on this matter? Is there any attempts made to ease the control?
Question should be answered by Mr. Professor OSHITANI, please.
Okay. For the first one, the question, as I said, we believe that the situation is quite different from that in the early April. But as you pointed out, we may see some more severe cases in coming days, and to prevent and of course the young people can also develop severe symptoms, and we also see some severe cases in young people in Tokyo, And so we need to monitor the situation. And also, it's important to prevent the spread from young people to elderly people. And now the majority of cases are occurring in the young people. But if the community transmission occur, the virus may reach to the nursing home or the hospital where the elderly people are hospitalized. And we need to prevent such transmission as much as possible, and so that we can reduce the number of severe cases. And also, we are trying not to create the same situation with the situation in April. And we saw the outbreaks in the hospitals and the nursing homes. And that's one of the main objectives right now. And in terms of the testing at the restaurants and the bars, we may see some asymptomatic cases in these settings, but the now focus is in certain areas, especially in Shinjuku. And in other places, we may find some cases, but the risk is much, much lower in other places. That's what we believe right now. Thank you.
Thank you so much. And on the third question, perhaps I should invite Mr. Osumi and Mr. Matano as well. Whoever wishes to take the floor.
はい。出入国在留管理庁の又野か。
I am Matano from the Immigration Services Agency who will respond. You talked about the foreign residents in Japan. They may go out of Japan, but they find it very difficult to return to Japan. Is there any attempts to ease this control? That was your question. So currently, looking at the infection status both at home and abroad, and toward reopening of the foreign travel and so forth, so of course, it's important that we seriously consider them on entire government basis. And what is more important is to continue preventing the further spread of the virus, and that needs to be ensured. And think about what kind of people will be subject to easing of the measures. Those who are out of the country, they should return. Do they receive the priority? Or would you place priority on the people leaving Japan, then returning here? Or who, at what location, and what kind of people will be covered? All these need to be worked out. So with regard to the details and the specifics, the government is making the consideration, examining them.
So much, Mr. Matano. Any more questions from those of you in the room? If not, I would like to take questions from the online viewers. We have a few already. One is regarding the situation in Okinawa. The situation in Okinawa with cases in the U.S. military bases, and where they're asking for the facts and comments. It actually comes from Mr. Robin Harding of Financial Times and Ms. Motoko Rich of New York Times. I will be answering that question. Basically, as you know, on the 12th, it was informed by the U.S. military base to the Okinawa office, Okinawa prefectural office, that there were 62 people who were confirmed to have been infected by the virus, of which 39 were in the Futenma airport, 22 were in Camp Hansen, and one from Camp Kinzer. Perhaps what we can say at this point is that this confirmation of infection was a result of proactive testing based on the fact that there were some people tested positive before that. So the tests were performed on the 11th, and the tests were confirmed on the 11th, and the result was as such. Secondly, I would like to mention that the U.S. Military is taking this very, very seriously, and they are, of course, tracing the contacts, as well as they have upgraded their restriction on the people from going out of the premises. Basically, under this strengthened system, unless it's essential, nobody will be allowed to go out of the U.S. premises, U.S. Military premises at this point. Thirdly, I think there's been a great deal of transparency. There has been some agreement between Japan and U.S. Based on the joint committee agreement that the U.S. military facilities will work together with the local clinical centers, or what we call Hokenjo, and they will be providing necessary information. Based on that agreement, U.S. military is taking the situation seriously, and they are showing willingness to work closely with the local governments at the prefectural level, as well as lower level of the municipal echelon as well. So as long we believe that it will not be possible to make any judgments at this point, but at least all the relevant authorities, relevant parties are involved, and they are indeed in close contact with each other, and they will be working together to make sure that the infection will not be spreading. So that is the question on the situation in Okinawa. We have some more questions regarding proactive testing in Tokyo. This is also from Motoko Rich. The question goes, given the social reluctance of customers in nightlife establishments, are most of your current proactive tests among employees? How are you going to test customers who may be traveling on public transit, going to work, visiting older families, etc.? Perhaps I should invite Professor Oshitani to answer this question, please.
In some of these testings, the customers are also tested, even if they are not symptomatic. But in these settings, it's sometimes difficult to identify all customers. They at the bar or the restaurant, and so not all of them can be tested. But if they agree, some local government or the public health centers, they are testing some of the customers, and this is also probably important to limit the spread, and so the mobile app also can be useful to identify these people to be tested, even if they are not symptomatic.
Thank you, Professor Oshitani. And then there's a third question coming from Motoko Rich as well. It goes, there was a recently reported outbreak in a school in Bunkyo Ward. Can you comment on that and what that might mean for schools going forward? Professor Oshitani, once again.
Since most of schools were closed until May in Japan, we did not see many cases in school children. But now most of schools are open, and it is not unexpected to see the cases in the school children, but the most of the children do not develop the severe symptom, and there is probably at least there is no evidence showing that the school children there can be a driving force of the transmission. For influenza, the school children there can be a driving force for the community transmission, but for this virus, the school children are probably not the driving force for the community transmission. But of course, we should do our best to prevent the infection in these settings. And it's also important to implement the control measures as soon as possible if the cases are found in the schools. And so we need to find the best way to detect the outbreaks in school. Since the children most of children do not develop the severe symptoms, and it's not easy to detect the outbreak in the school settings. But we are trying to develop some strategies. And another important question is what to do in terms of the school closure when we find the cases. And also, we are now discussing with the Minister of Education and some other expert what policies that we should have when they have some cases in the school settings. Thank you.
Thank you, Professor Oshitani. Oh, so you would like to add something? Okay, Mr. Umeda, please.
文京区のお話
About the Bunkyo Ward school situation, may I say something more? With regard to the outbreak in Bunkyo Ward, it was the outbreak seen in the kindergarten. And Professor Oshitani said that pupils and the kindergartners are not the driving force for the infection spread. However, on the other hand, although this is a current situation, we really need to detect as early as possible infections taking place within the school setting, just like in the case of influenza. So we are looking for the mechanism to immediately detect such a situation. So we are working together with the Education Ministry in order to strengthen the surveillance over schools. That's what we are attempting. So that is an additional piece of information I wanted to share with you. Thank you.
We have 3 more questions, all coming from Mr. Walter Sim of the Straits Times. The first question is, do you agree with how Chief Cabinet Secretary Suga's description of the recent rise in cases as a Tokyo problem? Why or why not so?
Thank you very much for the question. I do not disagree with Mr. Suga's statement, and because Tokyo is a main place, so many new cases are already happening for last several days, and particularly until yesterday, more than 200 cases per day. And so I think he might have described the kind of situations, and so many cases are happening in Tokyo. And so that's my answer to that. Thank you.
Thank you, Mr. Uyama. The second question is, Japan will launch a domestic tourism campaign on July 22nd. What is being done to alleviate concerns that cases linked to Tokyo might emerge in other parts of Japan, especially rural areas? How will Japan manage the risk associated with domestic travel? Mr. Uyama, once again.
Thank you very much. As you're aware, it's a really challenge, and it's not just Japan, but many other places in the world. Our challenge is how to enhance our economic and social activities while suppressing the virus and try to control under certain control. And so it is real challenge, but what we are trying to do is using our scientific knowledge found by experts. And this virus spreads mainly through clusters. And where the clusters happens, 3 Cs. And so we try our best to make countermeasures to avoid 3 Cs. And by using this knowledge, more than 100 different business groups develop their own guidelines. So we encourage people to honor these guidelines and try to prevent a kind of situation, 3 Cs, try to prevent clusters. So this is a main sort of preventive measures. And as far as the Tokyo's issue is concerned, as we have been explaining, we are making proactive measures where we believe that many of the cases are coming from the night-like settings. So as we have explained, we introduce proactive tests. And if we find the positive cases, we introduce certain measures to isolate them. So, so this is really proactive measures to do that. And also, there are other, of course, cases outside of these settings. And there are, as you know, case by each case, we try our best to make a tracing, contact tracing, and in particular, retrospective contact tracing to find the source. And by doing this, there are so many cases that we will be able to find a link. And if there's a link is found, those can be isolated. So these are the kind of measures we're doing. And so again, we are doing our best to promote economic activities while suppressing those virus under control.
Okay, and the third question from Mr. Sim is, how likely are business suspension requests again at the moment? There are reports that these are being considered in Greater Tokyo region. What factors will the government consider before deciding to reimpose such advisories? Perhaps I should ask Professor Oshitani, who has been deeply involved in the government process as well, to answer this question.
But this is actually up to the government to decide. But as I said, the situation is different. The current situation is different from the situation in April. And we are monitoring the situation closely. And we should be very cautious in restricting the social and economic activities. As I mentioned, our objective of the COVID-19 response is to minimize the social and economic activities while minimizing the spread of the virus. And we always have to balance between the minimizing the spread of the virus and the maintaining the social and economic activities. And so that's why we should be very cautious in restricting the social and economic activities. And but of course we need the monitor the situation closely, and if there is any sign of the widespread transmission, we may need to recommend to the government to impose some more the aggressive measures. But I don't think it's a time to impose the very aggressive measure at the moment. Thank you.
Well, thank you very much. As you know, at this moment, we don't think it's a current situation is a situation where we need such like such measures like introducing again the state of emergency. But we are very watching very carefully, and those kind of considerations is coming from, as we have always said, comprehensive considerations of various factors, including the current state of play of new cases, and the trend of new cases, and how the level of medical services, how many beds available, and so forth, and the monitoring capabilities, situation of the tests, and among others. And of course, we also take into very seriously the advice from the experts. Thank you.
Just one additional point. All restaurants, bars, and other setting should follow the guideline. And we developed the many guidelines. And if they cannot work, they cannot comply with the guidelines, we may need to close the places until they can comply with these guidelines. That may need to be considered, and we are seeing some outbreaks, not only in Tokyo but also in other places, and we knew that some of them or many of them did not follow the guidelines strictly, and all these places need to follow these guidelines. We also need to modify the guidelines upon the experiences in the different places. Thank you very much.
Thank you, Professor Oshitani. Are there any further questions? Okay, I actually see Nishimura-san of Radio France, please.
Go to travel campaign. I would like to seek opinion from Professor Oshitani regarding this campaign, because social activity, economic activity will not be suppressed. I understand that is not needed. Having said that, go to travel campaign is something to be promoted. That is to say, it goes counter to the control measures. What is your expert view on this campaign?
We don't think there is the widespread community transmission anywhere in Japan, including Tokyo, but that there are some the hotspot, not only in Tokyo but also in other places, and the people who went to these places, or the people who were potentially exposed to the virus in a different setting, not only in a nightlife setting, but also in the healthcare settings or nursing home settings. They should not travel, but the risk is still very low. If the ordinary people, the people who are not potentially exposed to the virus, they can be infected. And so again, it's a balance, and we need to be very cautious in promoting such campaign. But at the same time, we also need to maintain the social and economic activities, and so that's why we need to monitor the situation closely, and also it's quite difficult, but we cannot stop all the travels at the moment. The current situation is not that serious, and but the certain people at higher risk should avoid the travel, and so the old people should carefully assess their own risks before traveling. And
Okay, thank you, Professor Oshitani. Any more questions? Okay, Mr. Swift.
Thank you. Two slightly unrelated questions. One, last week there were results of a clinical trial for Avigan that were inconclusive, or you could say disappointing. So can you give an update on what you think might be potential treatments that could be used in Japan should patient numbers go back up? My second question is, we have seen reports lately of financial difficulties at a lot of hospitals and clinics in Japan, and increasing reports of hospitals canceling bonuses for staff, strikes among nurses, nurses retiring early because of this, all due to reduced income during the coronavirus crisis. Can you give a comment on that and any kind of remediation that might be done to assist healthcare centers in this crisis? Thank you.
Okay, thank you, Mr. Swift. Perhaps either Mr. Umeda or if Professor Oshitani wishes to speak on this, you're also welcome. Okay, Mr. Umeda, thank you.
はい、ありがとうございます。
Thank you. With regard to Avigan, the US, unfortunately, some of the reports said that the effectiveness has not been confirmed in a positive fashion. That's how the report has been saying. But going forward, with regard to Avigan, it's not that conclusive results have come about, because trial will continue. And if effectiveness is confirmed on the way, then based on that findings, and if approval is given, then of course promptly we will go ahead with the procedures so that as soon as possible, those pharmaceuticals will be made available to the general public in Japan. That is our basic stance. And also, as for the management economically of the hospitals, what can be done in terms of the supports in various different aspects, we are thinking about the assistances. And we hope that through these measures, we could support the hospitals and others, like additional remuneration, reimbursement from the health insurance system and so forth. And based on the current situation and the reality, it's important always to provide for a good medical care setup, so we will work in that way.
So any more questions? If not, it looks as though we've exhausted all the questions for today. So I would like to thank all of you who are here with us today here in this room, as well as the viewers online, and all the presenters on my side as well. So I would like to hereby conclude this conference. Thank you. Thank you very much.